There's great news about HIV, and I'm going to tell you all about it right now. I'm Dr. MarkAlain Déry from Access Health Louisiana. As a physician who specializes in infectious diseases and has been treating patients for years who've been diagnosed with a variety of sexually transmitted infections, I'm here to talk to you about the human immunodeficiency virus, better known as HIV. If you've just received a diagnosis of HIV, there's good news about how, with treatment, you can live a healthy life, be able to have a family if you want children, and enjoy the same life expectancy and quality of life as those who don't have HIV. There was a time when a diagnosis of HIV meant fear. Today, with new medications to treat HIV and with ways to prevent it in unaffected partners, fear is no longer part of the equation. In fact, with medication, you can actually become undetectable and hence untransmittable, a phrase known as U equals U. And you're going to learn plenty more about that later on in this video. Now, although HIV cannot be cured, it is important to know that it can be successfully managed. With medications, as simple as even one pill once a day, regular checkups with your healthcare provider, and honesty with your intimate partners, you can lead a very healthy life, as well as ensuring that those you care about are healthy too. Now, the most important thing about HIV is to know your status, and the only way to know your status is to be HIV tested. Today, I'll teach you about the virus. First, to let you know how to be healthy living with HIV, and secondly, how to help you communicate with others in your life about HIV in order to reduce the fear and stigma that can be associated with this virus. HIV can be contracted through sex or by sharing needles. In addition, an infant can contract HIV through childbirth. Yet regardless of how it's contracted, it is important to understand that getting started on medications and staying on them throughout your lifetime is essential. You may have just been diagnosed with HIV through a routine STI screen, or you may have exhibited symptoms such as fever, chills, rash, sore throat, or extreme fatigue. Either way, know that your HIV can be controlled. Once detected positive for HIV, you'll begin receiving antiretroviral treatment medications. That means today. These medications will eventually make your HIV viral load undetectable, meaning that it'll reduce your HIV to such a small quantity that it'll no longer be detected by a standard blood test. People living with HIV who have an undetectable viral load cannot pass HIV through sex or through childbirth, and they are untransmittable. That is the meaning behind U equals U. Undetectable equals untransmittable. This is huge. Just keep in mind that undetectable doesn't mean your HIV is cured. It means that the infection stops with you. And with continual management of HIV by taking your medications daily and through regular visits to your doctor, you will never transmit it to anybody else. Let that sink in for a minute. Having managed HIV means that you will not transmit to other individuals. Also, it means that HIV will not exert any power over you or your life. Other than taking a pill a day, your daily life will essentially be uninterrupted. Listen up. Now, this is important. Once you learn you have HIV, it is crucial that your sexual partner or partners be told and get tested at a clinic by their physician immediately so that they can begin treatment too. And because HIV is a sexually transmitted viral infection, it is reportable to the state, meaning that you may get a phone call from the Louisiana State Health Department asking you some basic questions to keep accurate statistics for characterizing infectious diseases in the region. They will need some information to help track HIV throughout the state. These people are contact tracers. I know it may seem awkward talking about your experience, but it's important to have this information for the health of the population at large.
I got some scary news last month. I was told I have HIV. I just remember hearing all the scary stories about HIV when I was a kid. I nearly fainted with shock and fear when he told me. But quickly, and I mean very quickly, My doctor told me it was treatable nowadays and not to worry. So thank God it's not like the old days.
What do you mean it's not like the old days?
Well, HIV wasn't always treatable. I remember hearing about people getting it and then they get really sick and weak and eventually die with AIDS. That doesn't happen as much anymore because now doctors screen for HIV and get you started immediately on medicines to reduce the virus's impact on your body.
Does the medicine cure you?
There is no cure for HIV actually, but the medications can lower the amount of virus in the body to the point that it's no longer detectable during a routine blood test. That means that it's under control and that I won't be able to pass it on to my intimate partner. And it means I won't get so sick from HIV that I become critically ill. The doctor calls it U equals U. It's an acronym they use to communicate undetectable equals untransmittable. That's why I'm taking the medications every day. I have been taking them since the day I found out I was HIV positive. I'm working to get to U equals U. Until then, I need to use a condom or refrain from having sex. But the first thing I needed to do was have a conversation with someone called a contact tracer. The doctor said since it is transmittable, that someone from the state health department would call me to get some information from me. He said they will ask me a few questions and that I needed to answer honestly. So I did that. It was fine and easier than I thought. I didn't feel weird about it, and the contact tracer lady was very nice. That made it easy.
So what did you do after he told you all that?
Well, the craziest thing happened. He gave me a pill to get started right there to treat the HIV infection. He also gave me a glass of water so I could take the pill immediately. Once I took the pill, he drank the water from the same glass that I did.
Why would he do that?
Well, this is the craziest part too. He asked me why I thought he drank from my glass. And I said, I think you're trying to prove a point.
To not be afraid of catching it from you?
Exactly. He said that people might act weird around me when they hear that I have HIV. You know, be afraid that I'll give it to them through casual contact, like shaking their hand or something like that. He wanted me to know that HIV is not transmittable from sharing utensils. He wants me to understand that the way to get HIV is through sex or from sharing needles, syringes, or other drug injection equipment. If a mom has HIV, she can give it to a baby during pregnancy, childbirth, or breastfeeding. But there's ways to prevent that.
What about your partner? What did you say to him?
I told him straight up. I told him that I wasn't sure where I got it, but I wanted him to be safe too. So I told him to go get tested. I suggested he come with me to the clinic where I went. He was scared, but he went and got tested. Turns out he is a positive. So that means we will take the steps to make sure he stays HIV negative.
What are those steps?
Well, to be really safe, he wants to abstain from sex until I'm undetectable or consequently untransmittable. And that's fine with me. I get it. I mean, we could still have sex with a condom or he could start taking PrEP. But I want him to do what makes him comfortable.
What's PrEP?
Well, it stands for pre-exposure prophylaxis. It's a medication to prevent HIV. So if Justin uses PrEP and gets exposed to HIV, the medicine is already at work in his body. And it will prevent the virus from surviving so he won't actually get infected with HIV. Hey, Dr. Dery, I want you to meet my boyfriend, Justin. We talked about my HIV diagnosis and he wanted to ask you some questions.
Hey, Dr. Dery. Thanks for suggesting to Jared that I come in and see you.
Of course. I know you have some questions for me, but let's get started with the most important one that I actually have for you. Have you been tested for HIV recently?
No, and now I'm pretty afraid.
I mean, it's obvious that Jared cares about you and your health, or he wouldn't have suggested that you come with him. So let's get started with the test. Once we figure out your status, we can adjust accordingly.
Okay, but what does that mean? I mean, what options do I have either way?
Let's say you test negative for HIV, then we'll take steps to get you started on PrEP. It's a medication that will prevent you from getting HIV.
Okay, so if I take PrEP, I can have sex without a condom and not risk getting HIV? Is that for real?
That's right. But if you test positive, then we'll start you on the same regimen that Jared is on. You'll start the medication, take a pill a day. Then you'll come back for additional blood tests in about 4 weeks. Come see me a few weeks later to determine how well that medication is working. Once you're undetectable, you'll be untransmittable. Okay, so what other questions can I answer for you?
Well, what else can Justin and I do to stay healthy?
Stay on top of your health care. What that means is that you need to come into the clinic about 3 times a year to get blood tests so that we can continue to monitor your results. Think of these appointments as you would if you've managed any other chronic health condition. If you're good about taking your medications every day, and I know you will be, then eventually you're going to become undetectable, which will then make you untransmittable. Remember, U equals U. When you are virally undetectable, you do not transmit virus to your intimate partners. U equals U. Okay, what else can I tell you to help ease your mind?
Well, honestly, Jared and I have been talking about having a future together with a family.
Yeah.
I mean, I'm open to adopting, but also thought about having a surrogate, with our biological baby. Does having HIV change that plan?
Not at all. If you do adopt, that's good on you. But if you want to have a child using the services of a surrogate, as long as your HIV remains undetectable in a blood test, remember you are untransmittable. So that surrogate can't get it, and neither can your unborn child.
Wow.
That's a relief.
Yeah.
Is there anything else we should know?
Well, yes, I'm going to tell you something that I would tell any of my patients, HIV positive or not: get your vaccines. And we can do that here in the clinic and make sure that you will get your age-appropriate vaccinations. It's just part of staying healthy and being part of your overall health care. Honestly, an HIV diagnosis can feel insurmountable. But once you know the facts, you need to breathe a sigh of relief. Here's what's important. It's important that you stay on your medicines. It's important that you cooperate with a contact tracer. It's important that you be honest with your partner. It's important that you use condoms until you're undetectable. It's important that you stay on top of your health. And it's important to remember, U equals U. Undetectable equals untransmittable. Now, we've come a long way in treating and managing HIV infections, but we're counting on you to do your part to continue to make the right choices to stay healthy. At Access Health Louisiana, we make it easy for you to live with HIV. When you take charge and make the right choices, you can stay healthy. There's lots of great news about HIV, and I hope that this video has helped you.